So welcome friends today to this press conference. Thanks a lot for joining us. This is a very special press conference because the 16th National Conference of AIDS Society of India, which is India's very reputed and prestigious medical professional body, pan-India body of HIV medical experts and scientists and researchers across the country. So thanks. This conference is coming for the first time to the Gujarat state and will be held in Ahmedabad later this week. So we have amongst us distinguished people from the AIDS Society of India who have really played a very defining role in shaping India's HIV response. Without any further ado, let me pass on the microphone to the Honorable panel of experts which we have today. And meantime, please be welcome to type in your questions, or you can also raise your virtual hand after, and please remember to introduce yourself and the media or organization you represent. So we have amongst us, let me pass it on to the President Emeritus of AIDS Society of India, Dr. Ishwar Gilada. As many of you may be knowing, he's the longest serving HIV medical expert in the country and credited to establish first HIV clinic in JJ Hospital, Mumbai in India, which was when the first case got diagnosed. So over to you, Dr. Gilada, for your opening remarks.
Thank you very much, Bobby. And let me introduce my co-panelists. There's nothing like to my left or right. We have President of ASI, Dr. Dilip Mathai, who is sitting in Vellore. We have Vice President of ASI as well as the Scientific Co-Chair of ASICON, Dr. Glory Alexander, Secretary General of ASI and also Co-Chair of the conference, Dr. Kumarasamy. And we have local Co-Chair of ASICON in Ahmedabad, Dr. Harsh Toshniwal. Harsh Toshniwal, if you can please unmute yourself and also start your video. Basically, this is the 16th National Conference of AIDS Society of India, which is one of the largest gathering of HIV experts, either in the field of HIV care or HIV research. We started our first conference in 2005 after the 5 years of incubation period of or small kind of childhood of ASI. But after that, we have been conducting our conferences annually. But from 2005 to 2009, there was no conference. Thereafter, most of the conferences we tried to do south and north, and we realized that whenever we had gone to north, our participation was little poorer as compared to south, because the HIV load, number of cases, that was still high in Maharashtra, Karnataka, Telangana, and Andhra Pradesh. That time it was Andhra Pradesh one state, Tamil Nadu. And despite that, we had conferences in Delhi twice, we had in Jaipur, we had in Lucknow, we had in Calcutta, we had also last year in Cochin, and for the first time we thought of Gujarat. And Gujarat is a vibrant state, all of you know that. And we realized that Gujarat is like a replica of India. It's not because Prime Minister hails from Gujarat. But if you look at the HIV prevalence of the country and HIV prevalence of Gujarat, it is the same, 0.20 or 0.19. And we really wanted to have conferences in different places so that we can move around and we can galvanize kind of activities in that area. For long, we have been having our partners with us, National AIDS Control Organization, Central TB Division. This time we also have a Gujarat Medical Council with us. We have Gujarat Tourism. Usually we have only medical people backing us, but here in Gujarat Tourism. Also ICPB, that is the Indian Convention Promotion Bureau from Delhi, they are with us. We also have Caprisa from South Africa with us. We have UNAIDS with us. So we are 8 partners, and we also have other educational partners which are supporting us. We will have a very good conference. We have widened the content of the conference. We have widened the scope of organization to incorporate a lot of other infectious diseases which are always challenged to us. Apart from HIV, we always did programs on sessions on hepatitis C, STIs. But this time we have also taken kind of 3 challenging programs. One is the climate change, and that climate change affects everybody. It also affects HIV work. It also affects healthcare. We are already reading a lot of things about artificial intelligence, and that AI role in healthcare, and HIV is also important. In infectious disease is also important. We also have a session which will talk about cyber security, but apart from that, it will also cover the HIV/AIDS Act 2017, the act which was enacted almost 8 years back, but till today there is not a single prosecution under this act. Single prosecution is not there. It doesn't mean that a violation of act is not happening. It is happening day in and day out. It also happens in medical establishment. It also happens with the insurance companies, but nobody is fighting. So I think apart from ASI's role of training and acquainting doctors in proper HIV care, update on the knowledge, what are the new things coming, how far we are from cure, it's an injectable antiretroviral therapy, injectable antiretroviral therapy prevention, that is called PEP or PrEP. So all those things are being discussed. But apart from that, we'd also like to have people who are in HIV care to understand what are the legal framework, what are the climatic changes, what are the artificial intelligence. And we know that AI is not going to replace human intelligence, but still we need to understand. And a lot of people, a lot of patients who come through only Googling, and we call them, when you come to any doctor and you have gone to Dr. Google, you give up one doctor. And that's the reason that we need to put all those sessions in place. We all know that we are in the era of infectious diseases, among them a lot of viral diseases, among them a lot of zoonotic diseases, which are arising from zoo or animal, then come to human being. So all those things we covered in past conference also. We'll briefly cover this time also. I would like to now introduce Dr. Harsh Toshniwal, who is a local co-chair. It's a good news to give you that this conference is being inaugurated by a very important person. Harsh. Unmute, Harsh. Harsh, can you unmute? Harsh, unmute. Please.
Yes, sir. Good afternoon, all. And I am Harsh Toshniwal and President of the Infectious Disease Society of Gujarat. And the best news what I can release is that just before 1 hour, the Honorable CM of Gujarat, Shri Bhupendra Patel, has agreed to and given consent to come for the inaugural function on 21st. So we are gearing up all situation. The rest of the things, as sir has told, that what are the challenges and what are the new things, and we are preparing right now dais and everything what is required, back support, and we all will be there. My team is there for Infectious Disease Society of Gujarat, and many doctors who are very much willing to join for this conference and to learn new things and injectable drugs, long-acting drugs, and as sir told, they will be updating their knowledge for next 3 days, Friday, Saturday, Sunday. Over to you, sir.
One thing I forgot to mention was that for the first time in 2005, any medical organization that started a conference without alcohol and without smoking. And there was a lot of opposition from medical circles, but we stood on our foot, we stood on our principles. And today, AIDS Society of India is called Pathfinder. Most of the conferences and even National Medical Commission, or there are different rules and regulations which are framed by different bodies. They all now state that the conferences should be without alcohol. So, and despite that, we survived, and we find that a better attendance in our halls than outside. Usually, 80% of the people who are registered, they are in the hall. Over to you. And now I would like to introduce and invite Dr. Dilip Mathai to say a few things about the conference and ASI. Your mic is on. Can you increase the volume? No, can't hear. No.
I think we can't hear you.
No, in the meanwhile,
Dilip,
can you start and share about the scientific content of the program?
Okay. Good afternoon to all of you. It's a pleasure to be part of this press conference, and so glad to hear the good news, Dr. Harsh Toshniwal, that the Chief Minister of Gujarat is going to be here at this conference as the chief guest. And we're all very excited about that and happy that he's going to be there. This conference is, as usual, we come up with the latest scientific updates in the field of HIV and AIDS, with also focus on other viral diseases, because we realize that we have to expand beyond just HIV and also focus on other infectious diseases which play a very important role in India, like tuberculosis and other viral diseases. So we have given importance to that also. And as Dr. Gilada already said, we are talking about, artificial intelligence, which is the big thing in India today, and how it can help us to not only help in the prevention, diagnosis, and treatment of infectious diseases, including HIV, but also how we can work towards development of resistance, how it will help us in that also. And of course, climate change and its impact on HIV. If you're looking at floods, then a lot of people are displaced, and then all the treatment that's being given for HIV goes for a 6. We have less testing, we have less access to treatment, and all the other things which happen when there is a profound climate change. Being the only woman on this panel, I must talk about the effect of HIV on women. So the scientific content includes that, the impact that HIV has on women, because there is a little bit of difference in terms of frequency of cardiovascular events, cerebrovascular events in women living with HIV, the impact on bones, HIV and menopause. We are focusing on all of that. And in addition to this, a very important topic that we are going to be talking about, and which has now come into the purview of India, is the fact that women living with HIV have a 6-fold increase in development of CA cervix compared to women in the normal population. And there was nothing very much we could do about that, because we didn't have a vaccine. As you know, 75% of all cancers, 85% of all cancer cervix are caused by HPV, but we didn't have a vaccine for that. We were dependent on a vaccine from abroad, which was highly expensive. But we have the good news that in the year 2023, Serum Institute of Pune came up with a new vaccine called Cervavac. And so now our goal is to be able to provide this vaccine to women living with HIV so that they can prevent themselves from acquiring CA cervix. So this is another important topic that's being mentioned and talked about in the conference. So these are some of the few things that I have to add to what has already been said. And somebody has asked this question about whether Cervavax is part of the government program in Gujarat, India. The government has taken this very seriously and is planning to make it into a national program. But I'm part of an organization called Cancer Cervix Elimination Consortium India, which is complementing the work of the government. In the private sector, a lot of work has already started, and many organizations are giving the vaccine to their patients. So, but the government has not yet come in with a massive HPV vaccination program, but it intends to do that in the near future. Thank you.
If Dilip, your mic is proper, can you come out now? Can somebody, Glory, can you call him and brief him? In the meanwhile, we'll have an intervention from Kumar. Kumarasamy is our Secretary General, and one of the few researchers from India, which is also known globally. Kumar?
Yeah, thank you, Dr. Gilada and Bobby, for organizing this chat with our media colleagues. As you heard from my important colleagues about the scientific agenda of the conference, where this conference is developed in a way that to discuss all the latest in diagnosis, in treatment, in prevention, and as well as some of the newer things going to happen in the next couple of years, all will be discussed with our clinicians. And there are a lot of interactive case discussions, not just on didactic lectures also, but also there are some sessions on debate, whether certain strategies like self-testing should be introduced in India or not. So today we have a set antiretroviral therapy regimen, which has been recommended by World Health Organization. It's also been adapted by our national program, which we all use it. But on the other hand, as you heard from Dr. Glory, that antiretroviral resistance are rising up among people living with HIV, even to some of the newer drugs what we have been using. in this conference, we'll also discuss about what new therapies available based on some of the clinical trials recently being conducted, how that can be used for our patient population, and especially for the lower and middle income country. All these discussions has also been planned in this conference. As I said, we're not just alone didactic lectures. We have lots of interesting clinical case discussions as well as debates. This conference will be a real treat for anyone who's been treating people living with HIV or doing research or who wanted to learn about more about HIV disease and to take care of them. Not just on HIV alone, all the other related infections like tuberculosis, viral hepatitis, and variety of other bacterial infections, fungal infections, pneumonia, brain infections, all those will be dealt because our people living with HIV, because of the low immunity, they're prone to develop all these infections around them. And again, these are all age-old stuff, but there are a lot of newer diagnostic tools are available to diagnose them. Those also will be discussed by the appropriate lab experts at this conference. We all really, look forward, for this conference, and also thank you, Dr. Harsh, for breaking the news that the CM of Gujarat will be inaugurating, and that will be a real treat through the AIDS Society of India. Thank you.
Basically, currently, the entire HIV field and health field is going through a lot of challenges. And you must be reading that the Trump administration has stopped funding for USAID, CDC, NIH, PEPFAR, and most of the programs are affected. So much so that WHO, UNAIDS, everything is affected. They freeze their travel, they freeze their funding, and now even WHO has appealed for people to join pro bono, that is free of charge work for WHO. At the same time, ASI is least affected because we are not on foreign funding clutches. We are self-sufficient organization. We run on our own program, on our own funding. And secondly, we would like to offer some solution to the global challenges or scenario. For example, the PEPFAR, President Emergency Program for AIDS Research. That program of government of US has been supporting a lot of treatment of Africa. Africa, as you know, is worst affected in HIV. So almost 20 million people, out of which maybe 18, 19 million people are on the funding of PEPFAR. That PEPFAR funding is stopped. They are going to release a little bit, but that is stopped. And we, from India, provided a solution saying that if any country in the world which can come to the rescue of Africa or any poor country is only India. How it can do that? If you even calculate the cost of medicine from US and that cost of medicine, every import or export attracts clearing and forwarding charge. So that clearing and forwarding charge is 1% to 1.5%. And Indian medicine is cheaper than that clearing and forwarding charge. So some of the medicines which are costing $100, India provides at 30 cents, less than $1. So that way, India can come to the rescue. Naturally, different governments of African nations, they will have to pitch in some money, but India can come to the rescue. And even PEPFAR was buying Indian medicine. So initially, they were talking about only medicine for branded companies or patent owner companies. But now, for last several years, they have been buying Indian companies. So Indian medicine. So I think India can be a solution in the challenging scenario.
So thank you, Dr. Gilada, for mentioning this. So one thing to our media colleagues, our national program, especially about the treatment program and various testing program, these are all being funded by the Ministry of Health, which I heard yesterday during one of the meetings with them. So 90% of the funding for our national program is taken by Government of India now, today in 2025. 15 years back, almost like 70% were funded by Global Fund and as well as other bilateral donors. So now over a period of years, our government has taken up this initiative to fund our national program, which really had today saved our country, particularly for people living with HIV, in this act, done by the US government of withdrawing this support through the USAID and through various other mechanisms through the lower and middle income countries. But on the other hand, 10% of the activities, what our national program does is through various other NGO partners who have, fundings from PEPFAR or USAID or CDC or variety of these activities. which again, I was told that not much been affected for India yet. So I think if that is an issue, then there could be some issues can happen, which again, government of India is willing to take care of this. So with all this, I think India has done really well. Will continue to do well with the current funding climate. Again, having said this, we should not sit tightly with what we have already done. And again, HIV epidemic in India plateaued over a period of years with a lot of effort done by government, NGOs, and various other stakeholders. But on the other hand, till now is rising up in certain pockets as well as in key population. If we don't pay our attention on that particular sector, again, HIV might explode, particularly in a country like India. We have 1.2 billion people where we have conservative culture, and again, sex talk is being a taboo in our country. I think this AIDS Society of India conference, ASICON 2025, will describe all those, how our doctors and policymakers keep vigil on this particular disease, not be just sit tightly with our older agenda, keep moving forward with some of those newer stuff coming up in terms of identifying people living with HIV, linking them treatment and newer treatment, and as well as some of the newer therapies available, which are much more better for people living with HIV with the less adverse events.
Any questions from the panel?
I would like to reinforce what Dr. Kumarasamy is saying about the government doing so much for people living with HIV. I think ours is the only program in the whole world which is doing this. We have 772 ART centers in the country where ART is given free of cost to people. No other government, I think, in the world is doing that. And it is something that really needs to be appreciated and is being complemented with the NGOs and other organizations working in the field of HIV. Of course, one area that we have still not worked very actively on is the area of PrEP. And though it is being provided in the private sector, that's one area that we need to also start focusing on in India.
Any questions from the attendees, journalists?
And there was a question in the chat whether equal importance being given for prevention in our country. So I will say definitely yes, because in all these years in our country, before the treatment therapy era started, only the prevention, happened. So then we learned, by doing some research studies, treatment is just a prevention. So if you treat someone, their virus level will come down and they'll be less infectious to others. So again, having said this, yes, to your question, both efforts are currently happening, but this should be ongoing. We cannot just do HIV prevention for one particular year and stop that. We need to have an ongoing programs and also a variety of programs, and also programs, one size doesn't fit for everybody. A certain population need different types of messages and different interventions, and certain population need. You heard about PrEP. There are certain key population who are looking to get PrEP. This is what is called pre-exposure prophylaxis. Before having a sexual act, you can take a medication where you can prevent the HIV acquisition, based on the clinical trials. It's been shown. Now, India is in the process of scaling up, still not done completely yet. And also now newer therapies are available. Instead of taking medications every day, where you can have injections every 2 months or every 6 months to prevent that. There will be a lot of presentation at this conference where it might be a big eye-opener for our national policy makers, when how we can adapt some of those newer strategies to prevent HIV in our country.
अभी किसी ने पूछा है कि प्रेप क्या है? प्रेप यानी प्री एक्सपोजर प्रोफाइलैक्सिस, यानी आप किसी चीज को एक्सपोज करते हैं या रिस्की बिहेवियर करने वाले हैं और किसी के साथ संबंध करने वाले हैं जो आपका रिश्तेदार नहीं है, आपकी वाइफ नहीं है, आपका सेक्स पार्टनर नहीं है, तो आप रिस्क ले रहे हैं HIV की, तो उसके पहले दवाई खाना। तो ऐसी चीज पहले भी थी जो सिफिलिस के लिए यूज की जाती थी, गनोरिया के लिए यूज की जाती थी। अब हमें पता चला कि HIV में भी काम करती है। There was also a demand that press release should be also in Gujarati, and I'm happy to share that we have a Gujarati translated press release which will be shared with the different part of media. We also have a Hindi press release. Yeah, Glory, you wanted to say something?
I just wanted to say a very important concept where HIV treatment itself is a method of prevention. We refer to that as TASP, treatment as prevention. That is, if a person is on regular antiretroviral therapy and his viral load has become undetectable, then this person cannot transmit HIV to another person, even if he has unprotected sexual contact. So that is a very big thing. We refer to this as undetectable is equal to untransmittable. And it is also a mode not only of treatment, but also of prevention. So the emphasis is now to test all those who are at risk and start treatment immediately, so that as rapidly as possible, we can bring down the HIV viral load of these patients, so that they will not be able to transmit the infection to anybody else. So this concept is referred to as U is equal to U. Untransmittable is undetectable is equal to untransmittable, and is a very important component also of prevention, in addition to all the other things that we talked about, such as pre-exposure prophylaxis, voluntary medical circumcision, condom usage. All of those are old age, long time preventive measures that we use, but putting them on ART and seeing that the viral load becomes undetectable and also PrEP are two very important methods by which this infection can be prevented to spreading from one person to another. So please remember the concept of U is equal to U, and this is something that has to be publicized widely, that if a person is regular on treatment and undetectable virally, that person cannot transmit the infection. And this is proved scientifically in several studies.
Can't hear well.
Can I
use yours?
As Glory said, I can little bit simplify and say in 4 lines. U is equal to U means if you have a lifespan in being born in India, as a male you live 71, as a female you live 73. Even if you are diagnosed at the age of 25 or 30 as HIV positive and take treatment, you can live up to 71. Your life is not reduced by even 1 day. Number 2, if you are already on treatment for at least 3 months, you become virally suppressed, you do not transmit HIV to your wife and would-be child. Number 3, you will not be hospitalized because of HIV-related illness. You can be hospitalized because of cancer or accident or something else, but not because of HIV-related illness. And 4th, no compromise in your life, personal life, financial life, professional life, social life, no compromise. And therefore, we call HIV is better than diabetes, because in diabetes there are a lot of restrictions. In HIV there are no restrictions, and we can go beyond saying that now U is equal to I. So sometimes I need to convince my patient how long I am going to survive, how long the virus will be there. So I said, if you do viral load of you and me today, it will be same. I being HIV negative, it will be undetectable. You being HIV positive, it will be still undetectable. So it's not U is equal to U, is U is equal to I. So that has become that. I think Dilip has able to fix the voice.
He's not now on the panel also.
No, he's there. He's there.
There is another area of concern is mother-to-child transmission or parent-to-child transmission, and I would like to emphasize that all government ART centers as well as the private sector both are doing extremely well in reducing this transmission from mother to child. If mother is HIV positive and she is taking treatment, her viral load will be suppressed, and I'm happy to share that in last 10 years. All those our patients or my patients, female patients who were pregnant, not a single child is born with HIV positive status. And that's our concern, or our one motto in Gujarat is that in private sector and the public sector, both together must take an approach that by 2027 or 2028, not a single child should be born with a status of positive baby to a positive mother. And that is almost we are going to achieve. That's the only thing.
Yeah, that I would like to add to what Dr. Harsh is saying, that prevention of mother-to-child transmission by putting them on ART is a very, very effective way of preventing the child from getting HIV at birth. And even in my organization, ASHA Foundation, for the last 10 years, Dr. Harsh, we have not had a single baby being born with HIV because of the effectiveness of the ART that is given to the mother during her pregnancy. So now we see less children born with HIV. The concern is after the age of 15, there is a little more increase because there are other modes of transmission of HIV other than just mother to child. But this is very good news that the mother to child transmission has reduced considerably in our country.
And this concept on U is equal U, undetectable is equal untransmissible, will also remove stigma in the community, where today people living with HIV, they have stigma. One of the things is because they are HIV positive, people feel, they might be transmitting infection to others, or they might be dying. These are all some of those stigma they carry with them. Now, with this treatment, they do themselves well. It's a good benefit to them because they will not fall sick. And as well as you heard from our other panelists, they will not transmit infection, to any of their partners. And that also, we feel, will remove stigma for them from the community. So this is something which has really had been achieved by doing various scientific research on this particular aspect on treatment as prevention.
Hello, can you hear me now?
Yeah,
Very well.
Okay.
Yes.
Can you hear me? Okay.
Yes,
I could I could hear most of what you spoke, but I don't know if we have covered this aspect, that HIV is now a primary care physician's concern, which means that the primary care physician has to be educated, which means that the students of the MBBS, the people who pass out of medical colleges, would need to have this education, as well as the faculty who educate them. Otherwise, why should we have this problem of over 175,000 patients, people living with HIV, lost to follow up? Now, that is something worrying and concerning to me. It is also worrying and concerning to me that 200 new cases are being detected each day. It's also worrying and concerning to me that 100 people die each day in a disease, in a chronic manageable disease, which has got the same lifespan as that of people who do not have HIV. Now, I wonder what is happening here. Is it lack of education, or is it that stigma and discrimination still exists, or are we not reaching rural India and remote areas in our country? If we do not address these issues, then we would not be able to eliminate HIV in our country. I am not saying that AIDS will no longer be there or new infections will no longer be there, but we need to address these issues. We, at the society level, at the policy making level, we say a lot of things on advocacy, but we have to reach out. I don't know where the problem lies. You have just now, our Vice President Dr. Glory said we have 772 ART centers, but still, why are we losing patients? We ought to be sending the Army, Navy, and the Air Force to tackle every single person who was put on therapy and not adherent to therapy. I think that is where the crux of the problem lies. And for that, you'd have to have medical students, postgraduates, being involved in primary care of HIV, along with the other comorbidities. Maybe specialists can come in or not. That's just my concept. And Gujarat has been spearleading several national responses. And Gujarat is a good place to begin with, especially when they have played a significant role in elimination of elimination of polio. I would say that has been a remarkable achievement, spearheaded by Gujarat. And you've got several medical colleges and having good postgraduate courses. And I'm so glad that the Gujarat Society of Infectious Disease has taken leadership in trying to develop infectious disease as a whole and HIV care in particular. Wish Gujarat all the very best in this, and I hope you will all take it forward. Look forward to seeing you all at the meeting this February. Thank you.
Yeah. So, Dr. Mathai, you brought a very important
Care
point on the primary care physician. I think today, people with HIV, because of antiretroviral therapy, they live longer. So, because of that, they are prone to develop other age-old diseases like diabetes and hypertension. And also, based on the evidence, that people with HIV also prone to develop various heart diseases, worsening of diabetes, occurrence of new cancers, and all this happen. So in this conference, we have special lectures by the experts on that particular topic also. Hence, this should also be learned not only by the infectious disease doctor, HIV doctors, but also by the primary care doctors, as said by Dr. Mathai, because many of these patients tend to visit them for those ailments, for diabetes, hypertension, as well as the cancers.
Adding to
Thank you.
that, I would like to say that we have many young physicians who are doing research in the field of HIV, and they submit their abstracts, and we choose about 10 of the best abstracts, and we have that, as oral abstracts at the conference. So we are encouraging young blood also to look at HIV as a possible career in their lives along with other infectious diseases. So we do encourage young medical students and MBBS students and young researchers, postgraduate students to do research in the field of HIV and to submit it to the conference, and the best ones are selected and presented at the conference. The other thing that we do with regard to this is have clinical case presentations where again young people present cases that they have seen in their hospitals and in their medical colleges, and then it's brought up for discussion. So these are two new things. These are two things that are also part of the conference, where abstracts, research abstracts are presented by young people, and there are clinical case presentations also by young people, which are then open to discussion in the forum at the conference. So just wanted to add that also, that we are not ignoring the primary doctors and the young doctors. We want them also to get interested in this field of HIV.
In addition to that, Glory, what we are doing at Gujarat is we have asked 10 medical colleges in Gujarat to nominate 5 more people from their colleges, particularly postgraduate students, senior and junior residents. And they will be supported by ASI to attend that conference.
Great.
So any other questions? Bobby, anything else?
Sir, you have already responded to the serodiscordant issue,
Yeah.
but there's another question on HIV self-testing. Madhu Babu, if you want to ask anything, he's a senior journalist from Guntur, Andhra Jyoti. So, Dr. Gilada has already responded to your question in the chat box, just in case if you wish. Sir, sir, if you can address HIV self-testing, and then we can wrap up perhaps.
Okay. HIV self-test has been approved almost 7 years before. But till today, HIV self-test is not part of our program, in our National AIDS Control Program. And we discussed this issue at 3 different ASICONs with NACO team. Somehow it is getting postponed. The effort which we made, and that time they responded was, if somebody tests at home and tests positive, that person may commit suicide. I think it will not happen, because our campaign of HIV being a chronic manageable disease has reached almost everywhere. Secondly, if you have a self-test for diabetes, self-test for blood pressure, self-test for pregnancy, self-test for COVID, which are COVID has just come to 4 or 5 years before. Why not for HIV? And you don't have to tell or immediately interpret that you are positive, because any positive has to be repeat tested. So we can write disclaimer in that it is a primary test. You need to repeat test. You need to do counseling. There are now a lot of scanners and barcodes are there. You put on barcode, you just scan and listen to some particular advice or counseling session. So all that can be done. By doing HIV self-test, if you look at this 95, 95, 95, that is 95% people who are HIV positive, they should know their status. 95% of the people who are knowing their status, they should be on ART, antiretroviral therapy. And 95% of those which are on ART, they should be virally suppressed. For the second and third, we are doing much better. In the first one, that is 95% people should know their status, we are at only 78%. So you should understand one thing, that if you are weaker in the first part, then you are weaker everywhere. because that second and third 95 is calculated based on what figure you get from the first part. So we are currently 17% less detection than we should have been. And those people are all marginalized community people, male sex with male, bisexual, some kind of remand home children, jail inmates. So I think for all such things, we should provide HIV self-test, and that will aid to the first 95. And we should do all whatever is possible. A lot of things we may not agree with the policies, but in the interest of people, we need to do that. By doing that, our 78 will probably go to 90 or 95.
Thank you, sir. So should we wrap up then? If there are no more questions, yeah.
And we can see them at the conference, and during the conference also we can have a couple of more sessions on area-specific briefings.
Yes, sir. Yes. Yeah. So thanks a lot, Dr. Gilada, and thanks a lot to Dr. Glory, Dr. Mathai, Dr. Kumarasamy, and Dr. Toshniwal, and every one of you for joining us. I will especially like to thank Dr. Mathai for bringing in the context of the number of people who get infected with HIV newly every single day, and the number of people who die sadly due to AIDS-related causes. As all the experts have probably said, that no one needs to get infected with HIV, no one needs to die of AIDS, because we have the science-based tools and approaches to prevent that from happening. And as Dr. Glory had highlighted, making sure that U equals U is a reality in life of every person living with HIV is so important, along with ensuring that all full range of combination prevention options to prevent transmission of HIV is also accessible to everyone in a rights-based and people-centric manner. So thanks a lot for joining us. We look forward to ASICON 2025, which will open in Ahmedabad on 21st of February. And we will share the recording of this press conference, which is on YouTube, as well as other details over email along with the press release. And congratulations again to the organizers for engaging the highest level. We talk of political will, but here is a medical conference which is happening which will be inaugurated by the Chief Minister of Gujarat state. So looking forward to ASICON 2025. Thank you so much, sir. Thank you, ma'am. Thank you, everyone. Bye.
Thank you.